Hello, everybody. My name is Dr. Matthew Qilin. Welcome to our series on cybersecurity for the medical practice. This is part of our monthly teaching topics with workshops and webinars under our Simplifying the Business of Medicine program. Let's jump right into it. Today, we have a great topic that we're going to talk a little bit about, which is cybersecurity for the medical practices. This is specifically designed for practice owners, practice managers who are interested in making sure they're protected on all sides from cybersecurity. I'm going to go ahead and share my screens and we'll jump into it. So before we begin, every month we put on a workshop and webinar series. We started with a blog on the beginning of the month, followed by the webinar, and then a one-on-one workshop where you can talk through some of the topics that we discuss on both the webinar and in the blog. If you'd like to learn more, follow us on doctorsmanagementgroup.com. You can register for the next session, and you'll get the notes and the recordings when they are recorded. Today, we're going to be focusing on four main aspects of cybersecurity, and we're going to relate it to both the physical, the building side, the people, the employees, but also from a HIPAA standpoint, what do you need to be aware of, and what questions should you be asking your team and your operations to make sure that you are protected in case you do have an attack. So we're going to focus on where the actual risks are today in 2026. What type of physical safeguards or protocols can you have or should you have in your practice? What type of technology controls you should consider? And then again, touching base on that HIPAA enforcement and coverage. So a lot to cover today. I know this is a pretty big topic and this is evolving, especially in the sight of AI. AI has been a revolutionary change in a lot of aspects of business. And unfortunately, it also has been getting harder and harder to prevent AI cyber attacks because of the use of AI. Just in 2026, in quarter one, there were over 200 ransomware attacks on private medical practices. And so you guys are the target. They're not going after those large healthcare organizations as much as or as often as they are going after the private practices. So in the past, historically, if you were a smaller practice, you could nobody, you felt like nobody really wanted to ransomware you. But today, they are going after the smaller practices and they've moved down market mainly because it's a little bit easier to get in the door. There's a little bit less protocols. Maybe there's a little bit, less security to protect some of that valuable data. Most medical practices that we serve, and I'm sure you're one of them, you don't have a dedicated 24-hour day, 24-hour staff member that's always overseeing all of your technology platforms. So that is one of those risks where you have to be aware of it. But who do you have? Do you have a vendor? Do you have somebody who can help make sure that you are protected from a cybersecurity standpoint? And ultimately, they want to shut down your practice because they know how much you depend on your practice. And so the average for ransomware specifically is about 17 days of non-production. So if you're a practice owner, you can imagine how much money you generate or collect in a single day. Multiply that by 17, and that's an impact in terms of revenue that is not coming into your practice if you're not able to see the patients. But items like rent and payroll, those typically continue to be a cost or an expense. So it's magnified multiple times because not only are you having to deal with a cybersecurity attack or ransomware, but you also can't necessarily see the patients if you don't have the proper backups and protocols. You may have expenses that you can't afford. And in addition, you're dealing with insurance and trying to figure out what to do to get your business back up and running. Then there's the headache of rescheduling all the patients that you might have had to cancel. Well, if you're like most practices, you're already booked solid. And so adding rescheduling has been a challenge. I know it's even challenging for you guys to take vacation sometimes because of the limited backup that you may have. And so, think of it as a forced vacation without any planning, but not a vacation because it would be very stressful. And then there's going to be like what happened, all of the due diligence of why did it happen? How did they get in? That's a very stressful period. And so at the end of the day, your risks as a ransomware, are things that there's some components you can control. but your risk from your vendors are also something that you have to be aware of. Who are you giving access to on a vendor standpoint? What are they doing with their cybersecurities? How are they controlling their entry points? Did you give them logins to your platform so they can work on things, but maybe they didn't protect their logins as well? So it is multifocal, and it depends on your vendors as well. So it's not just you; it's everybody involved in your business. So today we're going to touch base on the three main components of like where should you be spending your money and time. And so one of the biggest things we're going to talk about is an annual security risk analysis, which is really just do you walk through? Do you have the basics taken care of? So for those of you who may not be aware, the OCR is the Office for Civil Rights. It's an agency within the Department of Health and Human Services that enforces that federal health information privacy, security, and breach notification rules. And so they are the entity that you would potentially get in trouble for, but they also set some guidelines in terms of what you should be doing to enforce best practices. The second big thing is multi-factor authentication, MFA, should be on everything. That's why they give it to you. That's why they give an option. I know many of you may have Word, or Microsoft or your EHR, and you have the ability to turn it on and off. And so that is a risk that, again, you can turn it on and you have a little bit more protection. But if you don't turn it on, then that's protection that you're not using. And then phishing email training, and then testing those backups if you have an in-office server. So we'll talk a little bit about that. All right, so let's start with the physical safeguards. It's going to be your easiest and cheapest one. So when we talk a little bit about cybersecurity and safeguarding the checkpoints, the facilities, it's really about the basics. Do you have locks on your doors that need to be locked? Is the server room, if you have a server, locked? Are the server racks locked? Who has the key? Who has access to those? And how often are we giving that access out? But also throughout the office, obviously there's public entries, and there's, you have to move patients through and vendors have to come through, but are there the doors that need to be locked? Are they locked? And who has those keys, and what is stored in locked doors versus not locked doors? So kind of controlling the entry points of data is one of the big components that you should be mindful of. We talked a little bit about if you have server, who has access to the server doors, and how often are they coming. In the reception area, one point where all of the patients come in, what PHI is being seen, what's being talked about, what are those exposure risks that we can think about from a patient coming into the office, because that's going to be both your check-in and your check-out. And so what can be, caught off guard, and what could be potentially stolen at that point. And then really, having a visitor log and controlling non-patient visitors, just being aware where they're at, who they're doing, what they're doing in the office, what time they're checking in and checking out. So having that protocol in place to help make sure that vendors coming in don't just wander in, but that they're escorted and they're invited and that they're monitored while they're on your property. When it comes to workstations, clearly, most practices have multiple computers, probably combination of laptops and desktops in every room. The MAs carry them around. The front receptionists probably have 2 or 3 computers that they're working off of. And so what happens when they step away, when they have to walk into a room, or where they have to go fetch some paper, from whatever reason that they have to walk away? Do those workstations routinely get automatically locked? Is there a protocol to lock your screen so people can't come in and and find their way around? So that's an easy kind of adjustment to be made on the settings for your computers. Laptops and tablets, if they're leaving the office, or even if they're not, they should all really be full disk encryption. And that helps with reporting for any breaches that occur. If you lose unencrypted laptop, it is a reportable breach. But if you lose encrypted laptop, it is not necessarily a reportable breach. When it comes to portable media, think about thumb drives, anything that's a media that you can be moved around from computer to computer. How many are those? What are they doing? Why are we using them? Again, that's just something that can be grabbed and put into someone's pocket. And so we want to make sure that we avoid losing material if we don't need to have those around. And then older computers or ones that break, what are we doing with those? As many of you know, just because the screen breaks doesn't mean the computer broke. And so you can still access a lot of the data. You can take out that memory. So are you properly retiring those computers to make sure that they are safe, even if you're not using them? So a couple of components on kind of this first point is we call it the 10-minute walkthrough. Just 10 minutes, sit in your office, sit in your reception area. What can you see, observe, hear? How are the vendors walking through? Are people signing in if they're not a patient? You can look at those printers, faxes. Are we leaving information overnight, after 5 p.m. when you're walking out? Is there still papers, charts that can be seen that may, be preventable ways of spreading PHI? Try opening the server closet. If you have a server room, look around, see how much you can access without a key, and making sure that the proper doors are locked. We talked a little bit about the visitor log. Try some different rooms. Are the rooms properly locked when they have the proper storage? And then I like this one. One of my colleagues suggested, looking under keyboards, phones, where's those passwords at? Because if you can easily access the password, that might kind of null and void some of your insurance policies that you may have. And then the biggest thing that we've been seeing, and this goes along with the phishing emails, is socially engineered cyber attackers. They are really good at getting passwords. They pretend to be the EMR. They pretend to be the IT department. They pretend to be the bank. And they seem very nice. They break down the conversation. They get friendly with the people. And then they ask for that password. And so, role playing with your staff, what would you do if somebody called and said, hey, I'm with your IT, I need your password to access your printer or fix a computer glitch? What are those best practices? First off, never giving password is the best practice. But also when it comes to phishing emails, you have to teach the best practice for not giving username and passwords on links that you receive from email. So the education component for your staff, especially the new employees, but also maybe people with their first or second job that they may not have had that experience in the past. All right, when it comes to controlling the technology, multi-factor authentication everywhere, and appropriate access. You don't need to give the front desk full access, admin access to create new users. You don't need to give all access to all employees, whatever they're focused on, whether it's the electronic medical record, the bank access, the email access, to make sure that the user settings are just as important as the multi-factor authentication. If you don't have MFA turned on, here's a little suggested list of an order. First, start with your email. All emails should be multi-factor authenticated. Remote access VPN, if you remote access in, then the EHR, of course, especially if you have to VPN in before the EHR. Every administrator account should have at least, MFA on it for protection from the administration standpoint. That's typically where you create new users. You can log people out. You can turn off user access. And then all your banking, payroll, and credit card machine, merchant portals, should have multi-factor. Just because you don't want that money to go anywhere it's not supposed to. The other component of that is in order to give a proper access, you have to have one username per person. Sharing of usernames may save you a few bucks a month, but in the long term, it could really hurt you because that one password gets shared around between multiple people. If one of those employees leaves, or if they get fired, and resetting those passwords, there's some risk there. And then when you do terminate someone, make sure you know the steps to be able to deprovision their access, turn off their email address, turn off their accesses, stop all of their ability to interfere with your practice. All right, phishing. So phishing emails are the emails that look real, but are not real. They're designed to gather your username and password from employees, from people, from anywhere. They're designed to get access to a certain platform. So You might receive an email from that what looks like Chase Bank or a bank, and it says, your password expired. Please enter your old password and then reset it. But you didn't ask for it. It's random. The best thing you could do is not click the link in the email, but go to a browser, type in the website directly so you're not getting rerouted, and confirm if that's the case or not. Clicking emails, clicking links within an email is oftentimes one of the easiest ways that the phishing emails can gather your credentials very quickly. You click the link and it takes you to a mimic of the website you think you're supposed to be logging into. And this is where AI has caused a lot of difficulty because they can create the exact or very similar web page that you think you should be going to. So there's no red flags that it looks weird or different. It looks very legitimate. And so they trick you by making you sign in. And in the meantime, they just see your username and password, and now they have access to you. So training on the phishing is really, really important. What's not as easy to spot anymore is those misspellings. It's the weird email addresses that have like weird names on it. They've really done a good job of changing all that, make it really hard to distinguish between a real email and a phishing email. So just constant training and constant education for your staff is important. All right, if you do have servers, this applies to you. Anything that you can back up. If you've never backed it up, it's all theoretical if you could. So not only should you be backing it up regularly, but you should also be testing to make sure you can deploy it. And the whole purpose around this is if you had a ransomware attack and they lock down your existing version of your platforms, could you go into a drawer or a safe or a location, pull up a recent version of all the data you had and reload it on fresh new computers where you can continue to see patients, you can continue to see, have the data that you need to operate. If you could do that, then it allows you to be, a little bit more robust in the case of an attack. Now that attack still has consequences and it still has troubles, but at least you can keep the business running while you're solving that issue of the attacks themselves. Mention this about your vendors. So all vendors should have a BAA signed with you. You should understand what securities they do have, what insurances they do have, what compliance components they have, especially if they're getting, if it's related to an IT company, if you're an electronic medical record, anybody who's a scribe, medical billers, anybody who's accessing your EMR information on a regular basis, anybody accessing your network, everybody should have a BAA signed so that you can assign the risk of a breach, but it doesn't necessarily remove the consequences of the breach. Meaning, if they got hacked or attacked, you would still, as a doctor, as the practice manager, you would still have to contact all of those patients with regards to their data and let them know that there was a breach. Even though your practice didn't do it, the vendor is a direct extension of your practice, and they were the ones that had the fail point. And so you have to be the one that communicates to the patients. And that's designed in terms of the HIPAA protocols for PHI that's been leaked. So let's just touch base on HIPAA. So there's been a couple new rules lately and a couple of things that are still in process. So in terms of the kind of thorough risk analysis, that's been around for over 13 years. And again, it's one of those where you don't necessarily realize that you may have done it, but it might be outdated. You might have gotten a new electronic medical record. So understanding who had done the last risk analysis, is there one that you probably should do? I know our department that does our HIPAA risk analysis, they've been busier than ever, mainly because of all the EMRs switching over and new practice locations. You always have to update your risk analysis. So what do they expect to see if you ever get an audit? And this would, again, you should be talking to a HIPAA certified person, to be able to talk through your specific risks. But every system, application, device, every location that touches anything related to PHI, you should be evaluating. You should analyze it for the risks associated with it. Any of those threats or vulnerabilities, what ifs of or the likelihood of them being attacked or stolen, a remediation plan in terms of what you would do to prevent it, and that's just thinking through those different steps. Whenever you do have a touch base on this, whenever you do have a change in an electronic medical record or a new location or change in office, you want to make sure you update that. And then you might have heard about phase 3 kind of coming through. And this is the audits focused on the risk analysis and the risk management requirements. So $73,000 is the current minimum penalty per violation. You don't even want to think about it, but those penalties can become bigger and bigger, especially if there's risk isn't being properly managed. So in 2027, we are anticipating that the newest kind of rules will be implemented. They put out some proposed rules. They're in the process of reviewing it. So be aware that there are some updates that are coming on their way. And this is something that you should be keeping your eye on no matter what. But all of these best practices that we're talking about, anything related to the technology components, the passwords, the multi-factor, let's start implementing those if you haven't done already. Let's not wait to the deadline to be able to prevent attacks. As I mentioned, attacks themselves will delay patient care, but it also hits you financially. But what happens if you do get attacked? The first 24 hours, couple recommendations that I have for you. One is the best part is, the best recommendation is to practice before it actually happens. Have a protocol, understand have a conversation with your leadership team to make sure that everybody is aware of the best practices. Sometimes when you get those attacks and you turn off your computer, you sometimes have a hard time finding that evidence or turning them back on at all. So disconnect from the internet or from the network, making sure that you leave the computer on. Preserve the logs and images. Rebuilding destroys the evidence you need. Call your counsel first or your HIPAA security officer. Making sure that you're involving a lawyer, an attorney would be great. If you do have cybersecurity insurance, you may be directed to use a specific law firm. So you want to be able to know those numbers right off the bat, know who to contact at your insurance policy, know who to contact from the attorney's standpoint, and making sure you're calling them immediately. This is a good reason to have downtime procedures, is because you can, if it's in the middle of the day, you can immediately switch. You can continue to see patients to the best of your knowledge. We know that having all your medical records digital is challenging, especially if you can't access the computers. But with more and more EMRs going to web-based applications and the cheaper cost of laptops, you might be able to run out and quickly solve it with a couple new laptops. But having those downtime procedures is important. Now, even if you had a couple of sheets of each and you were able to make copies of them as needed, having those templates around will be a big deal. And just never afraid to negotiate a loan. It's not you should involve more and more people who are experienced through this. So we talked, if you have cybersecurity, you should have cybersecurity insurance. You should look at the supplements of those policies. The supplements are really what makes or breaks a policy. The supplements are going to be those limits on specific components of a breach. So extortion, regulatory defense, funds transfer fraud, those types of limits may make $1 million policy much less powerful because the sublimits are capped out at an early dollar amount. So understand those sublimits, and understand the erosion order, understanding the business interruption insurance, BI components, how many days you have to wait where you can't practice before you can file a claim. Is it immediate? Do you have to wait 5 days? And what does it cover? Does it cover the cost of rent, or does it cover payroll? What type of expenses can it help cover, since you won't be able to generate revenue yourself? So 5 questions to ask your broker. What is our modeled loss and how does it compare to our limit? Show me the full sublimit schedule. social engineering especially? Do we have dependent business interruption insurance for clearinghouse or EHR outage? Which counsel and forensics firms must we call, and what needs pre-approval? And the fifth question, does the policy advance costs or reimburse us after we pay? So again, those are the important things regarding the cost of payroll and expenses for the business. Can you keep your business open throughout this process? All right, so I always like to leave these webinars with an action plan. We talked a lot about various components today. So a couple of action plans that I would recommend over the next couple of months. The next 30 days, locate your risk analysis if you haven't done it or haven't seen one before. If it predates your EHR, consider doing another one. Turn on those MFAs, the multi-factor authentication. Do the 10-minute walk. Print tomorrow's schedule. It's a good habit to understand and just to have that available. And then just obtain the proof that those laptops are encrypted from your IT vendor or however you manage your IT. Potential next steps in 31 to 60 days. Build that inventory list, making sure you know which vendors are which, what points do they have access, what's their logins, what access do they have when they log in, and make sure we have a BAA on every vendor. Don't take them, don't trust them, just have it. Request that SOC 2 reports from your top 5 vendors. Perform a test restore and document the outcome and time. So how long does it take to restore your platform if you do have a ransomware? Retrain the front desk on callback verifications, and then turn on multi-factor for the EHR and every other admin account. And then after that, doing those written remediation plans with owners and dates for the risk analysis. Tabletop the incident response plan, making sure that the leaders of the team know what to do in the case of attacks. Maybe a couple of different scenarios that you can run through to be able to make sure you do the right steps in the right time. Make sure you understand your cybersecurity limits. Make sure you talk with your broker. And then make sure you just look at the risk analysis once a year. All right, so we'll end with, before we talk about the workshop, we'll end with kind of those takeaways. Small practices are the most important ones to keep safe these days. They're the easiest to kind of penetrate it, especially because they have simple things that aren't being done. Downtime is the practice ending event, not the fine. The fine, you have the insurance for, they'll work with you on it, but it's the downtime that can really hurt you, especially if you lose trust with your patient population. The risk analysis is the OCR actual enforces, so make sure you have that risk analysis available. And don't wait until 2027 to make any changes to your security. All right, so this month and moving forward, we're going to have a one-on-one discussion workshop. So we used to have these in group sessions. Now we're transitioning to one-on-one. After this webinar, you're going to receive an email with a link to sign up for a one-on-one. It's about 30 minutes just to talk through any specific questions you may have from the webinar presentation. And we could talk through, some ideas if you had something, if you think you should investigate some more in terms of what's needed for your protection for your practice. But go ahead and sign up when you get that email. Looking forward to talking with you and getting to know your specific situation. And please don't be afraid to register for the next event. We do these every month. You get a blog at the beginning of the month, a webinar, and the one-on-one workshop. Thank you so much for your time. Again, this is Dr. Matthew Klinsky, and this has been Simplifying the Business of Medicine. Thank you.